Look, Dr. Carter at the end will talk about the multifactorial nature of Alzheimer's. I'm focusing on one particular thing, chronic subacute infection and the inflammation that goes with that, and how that plays a role, what's been shown in the literature. And these are all treatable targets. And if you want to read what we've written about this is Dr. Trump and myself at Harvard. We published this book, The End of Alzheimer's, back in 2013. And then Academic Press, Elsevier picked it up and republished a modified version as second edition. So it's kind of a textbook. But if you want to understand infection in Alzheimer's, look at chapter 9. If you want to understand the eye in Alzheimer's, look at chapter 6 in that book. And then this book here is a real simple read, I think. I wrote this for Jonathan Landsman's Immune Defense Summit. And I'm really just explaining immunity, amyloid, cholesterol, and a little bit about chronic infections and some of the things they can do. But really, a lot of honor goes to Dr. Judith McCloskey, who has spent more time looking at infectious etiology, infectious causation of Alzheimer's, going way back to 1993. And in her original paper, she honored Dr. McDonald and others who told us quite a bit about these relationships. This is a paper that Dr. McCloskey wrote in 1993, Alzheimer's disease of spiroketosis with a question mark. But what she reported here in 1993 was observation in 14 autopsies of confirmed Alzheimer's disease where spirochetes were found in the blood and cerebral spinal fluid, and moreover could be isolated from brain tissue. Okay, an important thing here is she showed that beta amyloid, the so-called hallmark of Alzheimer's, was also present in these cases. And so what's happened subsequently is all the drug companies were focused on amyloid. Okay, and so here is in 2017, Roche failed. What were they doing? Biologics, anti-amyloid therapy. Here's Pfizer, spent tens of billions of dollars, maybe more, pulling out of the neuroscience research. They worked on biologics that reduced the amyloid found in the brain of Alzheimer's patient and the amyloid precursor, and all their studies failed. In fact, whenever they said there was a benefit, the drug companies don't have to report things they don't want to report. So I can tell you that every one of these studies on amyloid, the patients generally got worse than on no treatment. And I know in the villages, they were going around suggesting that people join their study to treat people with no Alzheimer's or even the earliest cognitive impairment. And I haven't heard much from those studies, but this is not something I'd recommend anybody I care for to be involved in. Let's look at another one. Why do trials for Alzheimer's disease drugs keep failing? A discontinued drug perspective, 2010. So the amyloid approach to Alzheimer's has repeatedly failed. Early interventions may be the last shot. I don't agree with the early interventions. Obviously, the earlier we get, this is a complex disease. And if you start having cognitive impairment, you're well down the path. You're not even early then. But they're searching for a new type of Alzheimer's drug, but it's staring us right in the face, and it's been around since 1986, 1993, Dr. McCloskey, Dr. McDonald. So here's one of her papers from 2006, fast forwarding from 1993. And what she says is that the beta amyloid deposits of Alzheimer's are induced by Borrelia spirochetes. Now, I know Judith very well, and she knows doggone well that this is not the only thing, the only type of infection that can trigger this response. But what she did here is she picked a vertical spirochetes, mainly from the mouth, and has studied them intensely rather than superficially going at a lot of different organisms, very intensely to prove causation. So she basically says here that Borrelia burgdorferi, which is really the spirochete from Lyme, not from the periodontal, from the oral cavity, and the inflammatory bacterial lipopolysaccharide. What this is, these are dead bacteria remnants from when your immune system kills the bacteria, causes changes that are the amyloid deposits of the AD brain, and they're observed fairly quickly. In fact, if you do autopsies on 30-year-olds who died in an auto accident, they already show signs of amyloid plaques in their brain. And as you'll see, that is what Dr. Tanzi and Dr. Moyer at Harvard call an antimicrobial peptide. So it's part of the innate immune response. So treating amyloid with all these drug studies is like using prednisone. It's lowering inflammation. It's lowering your immune response. It's an immune suppressant. So not a good thing. And then I'm one of the few people that has written on tau. So there are two hallmarks of Alzheimer's: the beta amyloid or amyloid deposits, and then the hyperphosphorylated taus or neurofibrillary tangles. And I probably will go into this next time, but these hyperphosphorylated taus show up in hibernating animals, and I'll create the connection here in a bit, but definitely not a treatment target. But this is the kind of work that Dr. McCloskey did, and she's an MD PhD, and this is from 2011. And she's looking at very stringent criteria to show causation between the spirochete. So neurospiroketosis and Alzheimer's are essentially the exact same thing. Alzheimer's may not be caused by a spirochete, but something similar. So it established that chronic spirochetal infections can cause slowly progressive dementia. Treponema pilatum, that's the STD. Other types of spirochetes from the mouth that meet so-called Koch and Hill criteria to prove causation. And, if you look at this study, the results show a statistically significant association between spirochetes and AD, Alzheimer's. And the p-value is almost zero. The higher the p-value numerically, the less the association. But when you have a p-value like this, it shows unequivocal correlation to the conclusion that the spirochete is responsible for the amyloid formation, and the spirochete is responsible for the neuroinflammation that leads to the cognitive dysfunction. That's the critical connection. So if we look at what is Koch's postulates, they were proposed to establish causal relationship, not casual. Sometimes I read that and I say casual. No, causal. Causation, relationship between pathogens and specific disease. Following Koch's postulate 1 and 2, the microorganism should be isolated from the affected tissue and grow in pure culture. Dr. McCloskey showed that. Regarding Koch's postulates 3 and 4, the cultured microorganism should cause disease when introduced into a healthy host and must be re-isolated and identified as being identical to the original causal agent. She has shown that. Obviously, she didn't do it in humans. This was done in animal models. And Hill's postulate talks about the strength of the association, consistency, specificity, showing that it's associated with slow disease progression, biological gradients, so we're looking at white blood cells, plausibility, coherence, experimental evidences, and analogy of the association to other things. So in other words, in this case, it wouldn't be just spirochetes, other infectious species similar to spirochetes that can also cause it. And, her paper, I'm not going to get into this, shows all of the above, all of the above. Now, Dr. McCloskey, here's her at a presentation. What she says, taken together the analysis of historical and recent data available in the literature following Koch's and Hill's criteria is in favor of a causal relationship between neurospirochetes and Alzheimer's. Now, since spirochetes aren't the only type of bacteria that can cause or exacerbate Alzheimer's disease or other neurodegenerative diseases, Dr. Tremp showed it in glaucoma, which is a neurodegenerative disease, that other organisms can also be involved. And I was invited to present at a very small conference sponsored by the gentleman who was supposedly giving away $1 million to anybody who could find the Alzheimer's microbe. He ultimately didn't give the money away. I'm not surprised, but he named many, many, many honorable mention individuals who showed pretty clearly. And Dr. McCloskey is just not a promoter, self-promoter, so she didn't even submit an application to that grant. But here's Dr. McCloskey. Several of these, like Angela Kamer is a dentist. David Sindelar, who's developing a drug in this space, very interesting guy. Here's myself and Jazz. And so we got to present Robert Moyer, interesting guy. Unfortunately, he passed away a year and a half ago from a glioblastoma. But he's the one that did the landmark work at Harvard showing that the amyloids that the drug companies considered a treatment target were actually the antimicrobial peptide, part of the innate immune response. And this was work he published in 2009, yet there's still amyloid work going on in the Alzheimer's space. It's, like Dr. Trump would say, it's mind-boggling, but there we are. Brian Balin, he at the Osteopathic Institute of Philadelphia has done some significant work, which I present here, from 1998 on, where he has taken autopsied brains and cultured the amyloid histopathology and showed the presence of chlamydia pneumoniae. So we have spirochetes, we have chlamydia pneumoniae. Several of these other researchers, I can never pronounce her name once again, Itsuki. She is the virus lady, the connection between viruses and Alzheimer's. And Dr. Tremp and even myself, to some degree, I don't test it a lot, have shown the connection between cytomegalovirus and glaucoma. I don't test cytomegalovirus very often, but every once in a while when I see someone with a neurodegenerative process and they have low white blood cell counts, but particularly low lymphocyte counts, then that's when you want to look for a viral component. And I've seen a cytomegalovirus connected to these neurodegenerative conditions in a small number of people that I've worked with. So team members, we have a number of folks that have contributed vastly. One of my favorite guys, other than Dr. Carter, is Jack Deletori, senior editor of the Alzheimer's Journal of Alzheimer's Disease. And I honored him in the preface or foreword of our Alzheimer's book. And then just some selected publications, which will be out there for your consideration and review as we go forward. But this was something that was published in 2016. And basically, this group of international researchers said enough is enough. We need to figure out how to publicize this correlation. So an international group of 31 Alzheimer's researchers published an editorial saying that there's no question that this connection, infection and Alzheimer's, must be considered in individuals. And that's sort of what the microbe contest, the $1 million microbe contest was designed to do. Not prove infection, but Leslie Noren's, his main purpose was to make it more of a political issue so that the FDA might fund more research in this arena. And to some degree, he was successful at that. So I laud Dr. Noren's efforts. So we'll look at oral pathogens. We've beaten oral pathogens to death. But I just had a consult with an individual just before this, and he's had bad oral hygiene in the past, and it's very clear, and he has some lung issues. It's very clear that if you have oral pathogens, they can get into the bloodstream. They can get into the lungs. They can get into the bloodstream through the lungs, for example. You go to the beach and you can taste salt on your tongue. Salt doesn't evaporate. How to get there? Little mists. So as I'm speaking, if we had a little backlighting, you could see a little spit or a little mist as I talk. While I'm aspirating little particles. And if you have oral pathogens, guess what? They can be breathed into the lungs. So that is a vector or a pathway for oral spirochetal organisms to get into your bloodstream. If your gut is weak acid, you're swallowing, that's another pathway. Bacteria normally present in the mouth can also release toxins that make their way into the brain. Once there, they may contribute to Alzheimer's disease. I'm not sure how they get in the brain directly. The nose is the closest thing to the brain. The eyes are very close to the brain, actually an outcropping of the brain. But once these organisms are in your vessels, they can get there through the lung, as an example. So Dr. Mayo addressed in the Chicago Dental Society in 1913, the next great step in preventative medicine must come from dentists. Very strong connection. So any type of level of oral infection, you don't have to have stage 3 or stage 4 periodontitis per the ADA to have a small trickle of infection and inflammation into the nervous tissue at the root, into the bloodstream, and now, through other pathways, for example, misting into the lungs. So, we've talked about this, and this was published in 2002. It's on my website under books for you to download. Very interesting treatise on oral pathogens. So I have this up here because this is Cortexime, and they're doing, I don't really like the drugs they're developing. They're more of the immune suppressing rather than targeting specifically. But what this company is doing as a public company is they are developing treatments for cardiovascular disease and Alzheimer's with the target of P. gingivalis. So the spirochetes, this all emanates from Dr. McCloskey and Dr. McDonald's work, where they set the foundation for the causal relationship between these organisms and dementias, neurodegeneration. And we talk Alzheimer's because it's more feared and more understood by the general public. So they're developing these drugs targeting P. gingivalis. Once again, this is Cortexime. So this is one of their publications, and what they're trying to block is a downstream effect of the P. gingivalis rather than P. gingivalis itself. I mean, there's merit there. Look at COVID. It's a virus, but it leads to a cytokine storm, and the cytokine storm is extraordinarily deleterious. You can have a virus, and if we can control the inflammatory response, then it may have minimal or modifiable risk factors downstream. And of course, the number one thing to do that in Alzheimer's and COVID is strong immunity. I like that Dr. Loudon always sends me things from the New York Times because I think their writers do a pretty good job at interpreting the research and publish very readable layperson information. But they say inflammation in midlife tied to brain shrinkage later in life. And this is a study published in Neurology, looking at a pretty good number of people, 1,600 plus. And they just showed that, let's see. Well, that's midlife. Hey, folks, they're calling 77 midlife. We like that. But their average age was 53. But the thing is, when you go to Mass General at Harvard with the earliest complaint of cognitive impairment, so before you haven't really gone and had an MRI, but now you have some cognitive impairment, you get referred up to a neurologist, they do an MRI, you have up to 17% brain shrinkage or brain loss at that point. So that's the insidious nature of this disease, that your brain has multiple redundancies. And so you can function at what appears to be full cognitive ability, even when you've lost 10, 15% of total brain mass. So it's quite significant. But what I like about this one is they're always blaming inflammation. And we know inflammation from COVID is a problem, but there's almost always, well, there's always something behind it. Could be heavy metals, could be sensitivities, could be stress, could be chronic infection. Okay, so Dr. Tremp would always say to me, look, inflammation's a treasure of nature. It's your immune system trying to work on your behalf. So, and every study shows that when you downregulate inflammation, yes, we can modulate symptoms. But when you look at mortality studies, that never improves. Matter of fact, it almost always worsens. So, Dr. Tremp and I wrote a paper talking about finding causal factors of Alzheimer's from pre-birth to death. And one of the studies we showed that was a 70-year prospective study, sort of, actually it was a retrospective study, was when people moved to the Kaiser Permanente healthcare system from areas of the country or the world that had high levels of premature birth. These are the people that were much more susceptible to Alzheimer's later in life. Now, premature birth, we can get into all kinds of discussions about that, but the University of Arizona did a great study on measuring P. gingivalis and other oral pathogens in the placenta of young women who had premature babies. So the brain is literally looking at this as a non-viable and trying to get rid of it. And modern medicine, of course, will save that child, and we can make that person, a productive human being. But the point is, under God's green earth, that fetus is considered unviable. So there's your link to inflammation tied to brain shrinkage. And what we do in our program, okay, I'll get to these later. I threw that in as a step, and we got all kinds of wrong stuff here. But anyway, we're looking at white blood cell counts, neutrophil to lymphocyte ratio, neutrophils, things of that nature, which are really what we're looking at to determine if you have chronic inflammation, and then titrating to oral testing or infectious testing to see where that's coming from. So here's a really good review article, Alzheimer's disease and peripheral infection. I think peripheral infection is important because peripheral sort of means systemic. We're seeing it in your regular blood tests. Whereas some people who have just a really localized infection, you can have both peripheral and localized or focal infection. Sometimes the blood tests are very deceiving. You'll see just the most minute elevation in a white blood cell count. That's why I encourage people that have severe conditions like lung infection, like memory issues, like depression, things of that nature, to do the infectious testing, because the white blood cell counts and the ratios of the different types of white blood cells don't always tell the complete story. So in this review, they look at the pathogenesis of periodontitis and the mechanisms by which periodontal infection may affect the onset and progression of Alzheimer's. And very important, this is a good point. Periodontitis is a treatable condition. Okay. The issue we have is, and I'll get to this in a bit, is that the quote, ill brain can perpetuate inflammation for a long time. So even though we consider inflammation a treasure, unregulated inflammation that was caused by an infectious process or similar can go unchecked for a long time in the brain. And so that's what makes treating, say, vascular disease versus Alzheimer's or a brain-related disease that much more challenging. Because not only do you have to get rid of the cause, but downregulating the inflammation is really no fool's game. And it's very hard to measure what are called microglia, or your inflammatory or your immune cells in the brain. So just more on this, microbes and Alzheimer's. Chlamydia pneumoniae. Chlamydia pneumoniae is presumed to be just an oral pathogen. A lung pathogen that we can pick up from the air, from just particles in the air. But it also can get into the oral cavity and multiply as well. So, and they're talking about a potential arthrogenic strain. You see my video content that I'll talk about either today or next time, is that I explain the connection between the chlamydia pneumoniae, vascular disease. We talked about that a bit last time as well. So more on periodontal. Not only periodontal diseases not only impact oral health, but are also associated with adverse systemic diseases, cardiovascular, stroke, diabetes, and respiratory diseases. So now you kind of get why it can affect the respiratory system through these mists. Excuse me. So we'll talk about treatment at a later date, but Dr. Tremp and I have a patented treatment protocol. It's an aggressive treatment. It's antibiotic based. I believe if that's not your inclination, what Dr. Carter does without antibiotics or pharmaceutical intervention would be your path to go. But this is chlamydia pneumoniae infection, mimicking mitochondria and infecting a neuron. And so identification, location of chlamydia pneumoniae in the Alzheimer's brain. So this is Dr. Balin, Dr. Brian Balin, and he has many, many papers on this. So Alzheimer's may have a link to infections, says Philly professor, and in particular, his study has been in chlamydia pneumoniae. And so you can see that he has published 74 articles. This is out of PubMed. With his original one, Identification and Localization of Chlamydia pneumoniae in the Alzheimer's Brain, 1998, 2004, 2006, so on and so forth. Many, many publications on this topic. Just a couple more slides. This has a link to our Alzheimer's and Eye website, Real Health Clinics, and I have a series of 4 videos here. They're all short, 5 to 7 minutes, that sort of explain the continuum of the vascular component of this disease. So for example, stroke, heart attack's obviously a vascular disease. Stroke, vascular disease affecting large vessels of the brain. Then you have vascular dementia. But Alzheimer's is considered a neurological condition only. And what I show is that that really is not the case, that in fact, Alzheimer's too is a vascular inflammatory disease. And I am going to stop right there, because otherwise I'll get too far in and not have enough for next time. But what we'll do right now is we will take questions on this topic. Let's see. Let me just change our view, speaker view. Good. So we have a few questions. Yes, the eye exam information is on my website, and I've got that link out there. Can the bad genes be turned off? Okay, Linda, if she found cerebral spinal fluid, does that mean that perhaps had a cerebral spinal fluid leak? Michael.
My question on that is that could these leaks, which I just had surgery for, be a way that these bacteria are getting into the brain?
Well, how did you get a CSF leak? Did you have a spinal tap or epidural that went through the dura?
No, I had an auto accident where I hit my head about 10 times right here in the forehead. So, and then they did 2 days of testing in the hospital and found the leak right there, actually.
Okay, so traumatic,
Yes, yes.
Absolutely, because that's opening up those pathways for pathogens to get in, without a doubt. Yeah.
Because that was one of the concerns of the doctor, that I would get meningitis because there was an opening there.
Yeah, of course. Yes.
So,
absolutely.
I mean, it's just interesting to hear this whole presentation and kind of tie that together.
Well, I think with the oral pathogens, you have, these pathogens will travel through this spinal fluid. Correct, Michael?
Yeah, absolutely.
I mean, you don't have to have an open pathway either.
No.
Yeah, and I've heard this really good doctor I've seen on many occasions who's wearing Tennessee colors today, the big orange. Talk about that'd be you, Michael. Talk about how everybody has a little leaky gut. Everybody has a little leaky brain. I remember walking downtown Boston with Dr. Trump one time, and we were up on Beacon Hill, and it's full of little cobblestone roadways, and the grass is growing up in between the cobbles. And he's just said, with age, we develop permeability between all our cells, and that's why he's not a big fan of like aspirin, because when you're older, you're already a little leaky, and that's going to make it just leakier. So that was his opinion on aspirin. Improvement optimization in mitochondrial health, does it show improvement in eyes or brain?
Say it again now.
Improvement or optimization in mitochondrial health, does it show improvement in eyes or brain?
Oh, absolutely. So, I mean, and really, that's one of the key problems, with disease progression is mitochondrial dysfunction. And of course, having healthy mitochondria and the healthy wall around the mitochondria with the good fats and so forth to allow nutrients in and to allow garbage to come out, which, is hindered by, the inflammatory processes and bad oils and all of this, which makes, the walls very rigid and not very permeable, causes dysfunction. So that's a really key component of ultimately getting healthier.
Yeah, and keep in mind these, Dr. Harshfeld 2 times ago talked about how the mitochondria evolved from bacteria into a symbiotic relationship, and these organisms are antagonistic rather than helpful. Sugar and amyloid connection, that was it, just that statement.
Well, I mean, having a high, sugar diet feeds also pathogens. So with the amyloid, which are, antimicrobial peptides, which also, by the way, ultimately are really dependent on vitamin D. So there's a particular antimicrobial peptide called LL37, which has broad spectrum anti-pathogenic capabilities for, viruses, bacteria, what have you. But if you don't have adequate levels of vitamin D, that antimicrobial peptide does not work very well. So yeah, that's why we always, promote low carbohydrate, low, especially refined sugar diets and so forth, because it depresses the immune system and then ultimately promotes a whole host of things. And of course, high sugar feeds cancer as well. So not a good thing to keep your diet on that level.
So Maura has a massive family, nobody in the extended family with Alzheimer's. What are the top drivers of these pathogens? First of all, most Alzheimer's is sporadic, not familial. 98%. Sporadic means comes out of the blue. So, you can travel abroad. You could have got a virus congenitally and then become vulnerable. We all, when you die, you start decomposing from within. So we all have them. It's just a question of how well are we controlling them? How well are we keeping them at bay so they don't become focal or localized in the brain, the eye, the joint, the heart, in my case, things like that. Michael, do you want to comment on familial versus sporadic? And
well, so I'm also trained by Dr. Dale Bredesen, who wrote, the second book called The End of Alzheimer's. And he kind of categorized Alzheimer's into 6 different categories. So, and as a matter of fact, the genetic part is really not on there. However, being ApoE 3,4 and 4,4 definitely increases your risk. But from an epigenetic standpoint, it is those things that drive it. So, briefly, type 1 being inflammatory and anything that causes inflammation. And of course, when you're doing our panel, looking at inflammatory markers like homocysteine and C-reactive protein and uric acid and sed rate and all of those things, which drive inflammation, is going to increase your risk for Alzheimer's. And of course, having the subacute infections like the Lyme, the mycoplasma, chlamydia, pneumoniae, toxoplasmosis, that also, drives inflammation. Type 1.5 being glycotoxic, and that's basically, type 3 diabetes of the brain, where you're on that continuum with high blood sugar and causing the AGEs, the advanced glycation end products, making the blood, more sludgy, and thicker, and again, causing inflammation, but also, increasing the risk for infectious processes. Type 2 is what we call atrophic, and that's a decrease in various hormones. So decrease in estrogen in women and testosterone in men, and low cortisol levels, low thyroid hormones, etc. So when I'm, dealing with patients, I'm doing a lot deeper dive testing, for these things. So looking at, a 4-point cortisol level and doing urinary, saliva, and blood levels of all of these hormones, because that's really key. And of course, thyroid, you really want to do a deep dive looking at TPO antibodies, thyroglobulin antibodies, reverse T3, all of these, because that's goes at a deeper level to truly ascertain how well your thyroid is functioning and so forth. Type 3 would be deemed toxic. So toxins can come from, let's say, glyphosate, pesticides. So I test all my patients for glyphosate and a whole host of many toxic elements, because that can drive cognitive decline. Also heavy metals like lead and mercury, cadmium, and so forth, that can come from, unfortunately, the large fish that you might eat from the sea. And let's say if you don't detoxify well, mercury builds up quite, readily. And over the years, that causes problems. Of course, mercury can come from dental amalgam, silver fillings, gold fillings, because they are 50% mercury. Again, from a detoxification standpoint, if you can't get this out of the body, it will accumulate. And just a whole host of other toxins, BPA, BPS, what have you. So I do deeper dives with that, doing testing for heavy metals and toxins and what have you. Type 4 being vascular, so a decrease in blood flow. I do like to have my patients do a calcium heart score, and also a carotid intimal media thickness, because that gives us what's at the large vessels. Of course, with our panel, just looking at red blood cell distribution width, gives us a really good idea of, the small vessel disease, which Dr. Lewis, has, educated everyone on. And it really starts there, and looking at the OCT, because this is something that can be earlier on detected and so forth. And then type 5 is traumatic. So, playing any sports, accidents and what have you, causing a trauma to the brain can, intensify the myocardial decline. But there are a whole host of other things, just, taking the medications, things that we call dementogens. If you're taking antidepressants, those for long term, that can enhance your risk for Alzheimer's. And the list goes on and on and on. So that's what I do with these patients. And my health coach, who's also Bredesen trained, we go at a deep level, also history, exposures. Oh, in the toxic category, I forgot, mycotoxins from mold. That's really a real problem for about a quarter of the population, because 25% of the population also has a genetic predisposition to reacting to the mycotoxins from mold, and mold is everywhere. So again, everyone is on a different continuum. They have different capabilities to detoxify. Everyone has, differences in the bucket of what they have, whether it's a quarter full, half full, or full and overflowing. That's where it really, you have to kind of, peel back the layers of the onion to truly ascertain. And fortunately, those labs that that I do at the deep dive are not covered by insurance. So they can get a bit pricey, but it really gives a great picture to find out what's going on and driving the disease process.
Thank you, Michael. A question on, if you have brain inflammation, does that show up in the CRP test? Interesting question. Done a lot of work in this space, but usually you have the horse before the cart. So you usually had something systemic first, so it usually shows up. But I'll show a very messy foam core thing. This is my chart on 42 people where I investigated white blood cell counts, neutrophil to lymphocyte ratio, neutrophils, CRP, fibrinogen, all these things tied to neurodegeneration. And there's no case where their blood is perfect. There's always some type of peripheral inflammatory marker. Measuring it directly in the brain, one of the tests that we don't do routinely because of the expense is, say, TNF alpha or the interleukins. These would be much more telling as to what's going on in the brain. But I think there are good surrogates for that. And since the brain is 10 times more vascular than anything else, average body tissue, we're going to see some peripheral inflammation as well. Hopefully that answers that. Rob says, if one has periodontal disease, what's the best way to get rid of that to prevent getting AD? Michael, do you want to hit on that?
Well, I mean, again, so if you have history of root canals or cavitations, and cavitations come from extraction of wisdom teeth, and especially if they have not removed the periodontal ligament, which, in the past, no dentist really did. I mean, it's only been fairly recent that has been, elucidated that is a problem. So if the wisdom tooth has been extracted and that's left there, that causes a nidus for infection. So doing things like a cone beam, a CT scan of the mouth elucidates much better than, just digital x-rays, because it gives you a 3D look at what's kind of going on in there. Because most people really don't have symptoms at all. They don't necessarily have pain. And of course, with a root canal, because they destroy the nerve and the blood supply, you don't have pain. So you really don't know what's growing in there. And oftentimes digital x-rays don't show that. Another way is to go to a practitioner who practices EAV, and that stands for electroacupuncture according to Vol. And it's basically an energy device that can detect various pathogens in the body, and it's actually quite accurate. The best known one out there is a device from Germany. It's called the Avatar. And there's a practitioner here in Atlanta that she specializes in detecting dental infections and so forth. So that can be done. As a matter of fact, I had it done myself, and I found out that I had some issues. And instead of having a root canal where there was a problem, I underwent ozone therapy. So about six or seven sessions, and then it actually took care of that. So you really need, though, to go to a functional medicine or holistic dentist who understands, the deeper depth that you need to go into. And the dentist that I went to here is the one who actually referred me to that energy medicine practitioner.
A really good question. After early symptoms already exist, can treating an underlying pathogen still be useful, or is it too late? Has the mechanism already been set in motion? The most complicated thing, and we'll talk about it next time, is downregulating the inflammation that's been set in motion. But obviously, or clearly rather, getting rid of the source that's been producing this chronically smoldering is absolutely essential. Now, downregulating the inflammation is also possible. So I think, we're all on the continuum. No, nobody here isn't at risk, whether you live to 60 or 120. So it's just a question of where you're placed on the continuum. And our philosophy, Dr. Carter's and mine, is no matter where you are, there's a good chance we can slide you back. Obviously, the further out you are, the more difficult, the longer the process. I've heard Dr. Carter talk about people that have pretty severe dementia, cognitive impairment. That's a 2 or 3 year journey. So you just look back and, if you have minor symptoms, a little glaucoma, no real symptoms yet, that may be a 6-month journey. But down-regulating inflammation in the brain is a challenging process. Restoring, but there are all kinds of techniques, and we'll be presenting some of those next week on how to improve plasticity, neural connections, brain waves, things like that can be disrupted by these inflammatory processes. So, we have lots of arrows in our quiver, and it really becomes a personalized plan to see exactly where you're at.
I have a quick question too, if you're
sure, and then we'll start. Yeah.
Okay, so my spouse has 2 APOE4 genes. There was no history in her family, but she does have Alzheimer's now. So I'm wondering how much infection has an implication for that. Does the infection turn on those genes? Or, all the literature says 80 to 90% of people with 2 APOE4 genes are probably going to develop Alzheimer's.
Well, it's definitely a higher risk factor, but but the underlying etiology, what causes the disease, would be the same. Dr. Tremp, my ophthalmology mentor, showed years ago when he stopped doing this testing that if he had two people with macular disease, which is very similar to Alzheimer's, it's an earlier vascular neurological complication in the eye, that if he had two people, one with a double 2 and one with a double 4, that when he treated them, they both saw the same level of improvement. So the gene can be a trigger to make more people susceptible to it. But, how do you treat a gene? You don't. You treat what the manifestation of that susceptibility would be. And at the end, Dr. Carter will be talking about his expertise as both trained by my mentor at Harvard and by Dale Bredesen on this topic. So, he's a very important resource for particularly the more complicated individuals in this space. I'm trying to find people with the earliest mild cognitive impairment or seeing early signs of neurodegeneration that are relatively asymptomatic, whereas Dr. Carter is going to be a much more deep dive, thorough, looking at all these things. Can these bad genes be turned off? That's a question I don't really know the answer to, but I know my last talk, which will be posted very shortly, our last talk, Dr. Carter and myself, about how these organisms can turn genes on. So I would assume that if an organism can turn certain genes on, if you get rid of that organism, you may relax back to where you were before. But that's, this is sort of uncharted territory. I make it akin to sort of like Mendeleev when he discovered periodicity in elements, that at that point they really didn't know what to do about it, but they knew it existed. I think we're kind of in that phase in terms of our knowledge about the epigenetics and genomics, and that we'll learn more as time goes on. But right now, our focus is on what are the risk factors and what can we do to treat based on the risk factors that show up. So whether you are 2-2 or 4-4, if you have chlamydia pneumoniae or other infection that may be creating the amyloid, which I'll talk about very shortly, then this is something that is a target of treatment, whereas the alleles are not.